Congrats.
Congrats.
Thank you. Good afternoon. My name is Bernard Rubenstein. I am the Managing Director for Franchise Benefit Solutions. Our presentation today, we're going to discuss facts about Franchise Benefit Solutions, why offer benefits to your employees, our program advantages, our program or our products portfolio, solutions to help you hire and retain employees, our benefits enrollment platform, looking ahead to the special group special enrollment period, and like I said, at the end, questions and or comments. With over 35 years of experience specializing in customized benefit programs to the franchise community, Franchise Benefit Solution provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with authority brands, Valpak, Comfort Care, Grocery Outlet, Jenny Craig, and amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative plans to help recruit and retain employees. We're having here we go. Let's talk about offering benefits to your employees. Employees are the heart of any great business, and key employees are leaders, and leaders are essential to long-term success. Once you get a great team in place and they're performing well, it's a huge blow to lose any of your indispensable employees. Benefits are no longer a perk in today's business world. They're an expected part of compensation. Here are a few good reasons to offer benefits to your employees. Attract and retain your best employees. By offering quality benefits, you will attract and retain qualified candidates for your business and keep your best employees happy. Increase your bottom line. By offering benefits instead of higher wages, you win by having a lower wage base match for state and federal unemployment taxes. Boost morale. By offering a benefits package, you show an invested interest in your employees. In short, benefits help promote good morale by keeping employees happier and healthier with less turnover for your business. Promote health and wellness. When employees have access to wellness, preventative care, doctor visits, and telemedicine programs, your overall business environment is healthier. Fewer employees are out on sick days and fewer people coming into work while ill equals increased productivity and profitability. Beat the competition in the race for talent. By offering an ACA compliant health plan and voluntary benefits, you can beat out half of your competitors that do not offer benefits. And finally, create loyalty. Health insurance is an emotional offering. It says to your employee, you are a valued asset to this company, and we care about your health and well-being. You're probably thinking, why Franchise Benefit Solutions? What's the advantage of your program over other programs? Or what if I looked at similar plans on my own? Franchise Benefits offers exclusive group plans and rates, all with guaranteed acceptance and no waiting periods. Plans and rates are the same no matter where your franchisee is located. If you have a franchise in Florida, Michigan, Washington, or California, the plans and rates are the same. We have no participation or contribution requirements. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. You choose the benefit you want to offer your employees, and your employees enroll online through our online portal. Our products portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Again, plans can be employer paid, standalone, packaged, or voluntary or packaged together through convenient payroll deduction. Our health plan platform, we offer 3 group plans or individual health plans. We offer an individual and families health plan, comprehensive group health plans, and voluntary group health plans. For those franchisees that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family, we offer an online quoting portal you can view at your own convenience. Once you input your information, you can compare affordable health plans from different carriers, find out if you qualify for financial help, view benefits at a glance, view local providers, and apply online or download enrollment forms. As you can see here, this happens to be here in Michigan where I'm located. You'll see from the lowest plan to the highest plan. At the top here, you'll see what your subsidy would be if you're looking at plans through the marketplace. The rates here will show you what the monthly rate is minus the subsidy. And then again, you can view plan details, look for local providers, and then add the cart to if you're looking to enroll. If you're considering your group options, we can help you make the right decision that best meets the healthcare needs of you, your business, and your employees. Group plans are based on the demographics of your company, along with your employees and dependent ages. We would need census information in order to provide you with a group plan. We offer ACA and non-ACA compliant plans. ACA compliant plans are community rated, while non-ACA plans are based on the demographics and medical history of your employees. Non-ACA plans can be much lower in cost than the ACA plans. ACA plans require a minimum of 2 enrolled employees and will accept eligible waivers such as Medicare, Medicaid, Marketplace, spousal coverage, or other group plans. Non-ACA plans may require a minimum of 5 enrolled employees and will not accept any waivers. For example, if you have 15 employees, a minimum of 7 employees are required. So basically, the non-ACA plans were the plans that were available prior to the Obamacare or the ACA. ACA plans are what's currently rated, and we probably enroll 90% of our major medical groups are through the ACA type of program. So far, I've covered 3 healthcare options: individual and family, and comprehensive group health plans. Our third and most popular option is our low-cost voluntary group health plan, similar to an association plan. Our voluntary MEC plans are all about access easy, low hurdle access to the healthcare system, unattainable for many employees. The basic MEC plan covers preventative care, while the MEC Plus, Premium MEC, and Super MEC plans covers preventative services, primary care and specialist visits, along with urgent care, lab and x-ray services, and prescription drugs. The Premium MEC and Super MEC plans include value-added benefits, which is a cash benefit payout to the employee to help avoid a financial crisis. Members pay co-pays only, and there's no balance bill for those covered services. Members must utilize a PHCS network provider and excludes out-of-network services. So as you can see here, the basic MEC covers physicals 100%. The basic MEC, Premium MEC, and Super MEC, the top section here, has a $15 copay for primary care and specialist, $50 copay for urgent care, $50 copay for lab and x-ray, and generic prescription drugs is a $15 copay. The value added benefits, which I mentioned, are paid to the employee. There's hospital admission, hospital confinement, accident initial treatment, ambulance, diagnostic testing, critical illness, and term life rider. And again, these are benefits that are paid to the employee. There is no employer participation or employer contribution. Same plans, same rates in all 50 states. The preventative care include wellness exam, immunization, any type of testing or screenings, flu shots, colonoscopy, and mammography screening, all covered at 100%. It's part of the ACA. So what are the most popular solutions to help you hire and retain employees? We generally find 4 packages that most employers or most franchisees will choose one of them. Package 1 is the employer offers the dual MEC plan, which I mentioned that we offer the 4 plans. The employer contributes towards the employee cost, employee only cost. The employee contributes the balance of the employee cost plus dependent cost in any buyout plan. The employer then offers the voluntary benefits to include 100% employee pay for dental, vision, voluntary life, telemedicine, accident, hospital confinement, and short-term disability plans. Package 2, the employer enrolls in a management-only group health plan through the special enrollment period, which I'm going to get into in a little bit. Here, the employer contributes 100% towards the ownership, management 50%, and then the balance would be, let's say, wellness employees, wellness coordinators. Employer offers the voluntary benefits at 100% employee pay, and that would include the MEC plans, our hospital confinement, dental, vision, voluntary life, telemedicine, accident, and short-term disability. I neglected to mention that our voluntary benefits, which I'm explaining right now, those can also be employee pay 100%. You as the employer pick and choose how you want to set up the plan. You have total control. So we do offer additional voluntary benefits. Package 3, employer enrolls in a comprehensive group health plan. The employer offers a dual medical option that contributes 50% of the employee cost of the lowest plan. The employee contributes the balance of the employee cost plus dependent cost in any buyout plan. And then the employer offers voluntary benefits at 100% employee pay, like I said, for the voluntary benefits, dental, vision, voluntary life, etc. And package 4, the employer offers voluntary benefits to all employees at 100% employee pay. The employer does not contribute to any of the voluntary benefits. I was asked a couple of weeks ago if I could show generally how our plans are set up, cost and whatnot. So I put a little cost breakdown together. Just remember that this is set up based on we know that you have doctors and wellness coordinators. So what I did is I've put a 4-step setup, which I put in a monthly cost, what we generally see. Step 1, the employer sets up a class of employees based on the job title. Class 1 would be yourself, the ownership. Class 2 would be doctors and any type of management. And class 3 would be wellness coordinators. Step 2 is the employer would set up a comprehensive group plan for ownership, doctors and management level employees. The employer contributes 100% for ownership and 50% for management employee. And that would also include the doctor. Employer sets up the voluntary medical plan for wellness coordinators at 100% employee pay. And step 4, the employers offers additional voluntary benefits to the all employees at 100% employee pay. And again, that would include the hospital confinement, dental, vision, voluntary life, etc. Monthly cost, we have based on an age 55 owner. We generally work with United Healthcare as our main carrier, but we do have other carriers. The owner here selected the PPO plan with a lower deductible of $2,000, 80/20 coinsurance. Primary care physician is $40, $50 urgent care, and $15 prescription drugs. Monthly cost for owner age 55, single, $885. And again, this is just an arbitrary number, but it's generally going to be in that vicinity. The employer contributes 100% for himself. A doctor age 47, again, through United Healthcare. The employer selected the same plan, but with a higher deductible. Instead of the $2,000 for himself, he selected a lower deductible or a higher deductible of $5,000. Same coinsurance, doctor, a primary care visit, copay, urgent care, and prescription drugs. Monthly cost here for an age 47 doctor is $657. The employer splits the cost, paying 50%. And then for the wellness coordinator, let's say age 58, through Lucent Health, which is our current MEC plan provider, the employer selects the MEC Plus, $15 primary care physician, copay, urgent care 50, and prescription drugs 15. Monthly cost is $109, whereas employer does not contribute and the employee contributes 100%. So this is just a cost breakdown. Obviously, each one of your franchises are going to be different. So we work with you, just giving us idea what your thoughts are, and we'll set up the solution for you. Our benefits enrollment platform, from the time we have the initial phone call through the enrollment, we offer 4 steps. So step 1, which is the discovery, is to identify your objectives of offering benefits that reflect both you, yourself, and your employee needs. We will gather your group information, discuss your goals, benefit options, and your budget. Step 2 is the analysis. So once we gather your information, your census information, we go to the carrier to obtain quotes. Once we get the quotes back from the carrier, we will present them to you, and then we'll give you time to review, and then we'll reach back out with you and formulate a benefits plan. Which brings to step 3. Once you've made your decision on the direction you want to go with, we will provide you with an easy to understand communication that you could distribute to your employees. We would either provide you with a 2-page communication or a employee guide. Generally, that's about 10 pages. So it's gets more in depth into the coverage available. We may conduct a benefits webinar for your employees. And while we're doing it, our implementation team will begin to build out the online enrollment platform, which brings me to step 4. Our online enrollment platform ties the employee communication to our enrollment system. I'll go over that a little bit, how our online enrollment works. We will send you an email along with your employees. Once your employees receive the login email, it'll come from us welcoming them to our ease platform, ask them to register to the portal. Once they are registered, they'll have to put in, they'll update their profile information. It's more of their personal information. Once they've done that, they'll be presented with their benefit options. As you can see here, this is just an example where they're offered 3 medical plans that'll give them their cost, their plan details, and the costs are going to be based on whatever the payroll deduction is for your company. They select the benefits that they're interested in. On the portal, it'll show them each plan as they go through it, what their benefit summary is and what their payroll deduction is for that payroll. During the year, they'll have the ability to access the benefits. They'll be able to obtain their ID cards and access any plan information through their profile. They'll have to go to the document page. You, as the employer, have year-round metrics and reporting. There are over 20 reports that you can download, including payroll deduction report, which you would then forward over to your payroll deduction or payroll provider. Looking ahead to 2023, believe it or not, which is in a couple of months, there's what's called a group special enrollment period. As I mentioned when we were discussing the different packages, the group special enrollment period is probably our accounting season. It's a 30-day window between November 15th and December 15th. It's under this enrollment period is under the guidelines of the ACA. Carriers are required to offer an annual group special enrollment period to employers who do not meet participation or contribution requirements. So again, it's a 30-day window where you can enroll in a group plan, no participation or no contribution requirements. Under normal guidelines, as I mentioned before, you would be required to have 50% of your eligible employee participation. So under this 30-day window, you do not. A group, being that this is a group plan, the carriers require 2 full-time employees or 2 full-time W-2 employees that would have to enroll. Husband and wife is considered as 1 employee. Therefore, you would need to have 1 W-2 or 1 active W-2 employee. Now we're at the end here. If you have any questions or comments, now is the time to address them. Carolyn or Ronnie, do you have any questions?
I do not at this time. I was mostly on for auditing purposes from the corporate side. Dr. Good or Bill, do you have anything else?
I wonder if you would mind, and I don't want to hold everybody else up. I was busy screwing with the technology here when you were talking about the MEC plan. I'm unclear on what MEC is. If you could, I know you went through it, but I just missed it. Could you touch on that again for me?
Sure. Please? Do you want me to go back to the actual page?
That would be fine if you don't mind.
Sure. Let me pull it up here. So you can see it on the screen here. We offer 4 plans. Basic MEC covers 100% of preventative care. MEC Plus, Premium MEC, and the Super MEC offer benefits at copays, no balance bill. Office copay, 15 copay, specialist, 15, urgent care, 50 copay, lab and x-ray, 50 copay, and generic drugs, $15 copay. What it does not cover, and we do offer a hospital indemnity plan. It does not cover inpatient, outpatient, or emergency services. But again, our hospital confinement plan does offer you some benefits, some hospital benefits that most employers will package with this MEC plan. The average cost on this MEC plan is $110, whereas the major medical health plan. For instance, 47-year-old could be about $600 to $700, depending on what state you're located. So
All right, thank you.
big difference, but we find most employers will contribute towards one of these MEC plans, but then they'll package the hospital indemnity plan with this at the employee cost.
Perfect. Thank you so much for doing that.
Okay. Any other questions?
Not at this time.
No,
Okay.
good.
I forgot to include one thing here. Let me put this sharing back up here. I have our contact page up here. If anyone is looking for any benefits, wants to reach out to us, my email and phone numbers here. We're also going to send this recorded presentation to corporate, and they will distribute it along with our contact info and the employer guide. So if you don't have any other questions, I think we will end this. Any other questions?
No,
No,
thank you.
thanks, Bernard.
Okay, I appreciate you taking the time off here. Hope you have a good weekend, and thanks for attending.